Hi, everybody. I'm Kent Pavelka, and welcome to this edition of Metro and More. You know, for some of us, a trip to the dentist can cause some anxiety. But thanks to technology and training, that semi-annual visit is now pretty easy and comfortable. Today, we're at MCC's South Omaha campus, and we're going to be learning about the college's dental assisting program. So thanks for joining us.
Greetings from the set of Metro and More at Metropolitan Community College, serving more than 50,000 students with over 120 programs at our 8 locations in the daytime, evening, weekends, or online.
Welcome back. We're here with Joan Trimpe, Dental Assisting Program Director and Instructor at the Dental Assisting Program in MCC. We're in the lab, and it's good to have you. Good to see you again, Joan.
Nice seeing you again.
The folks out on television are watching and wondering where we're at. We're in the lab, correct?
We're over on the dental lab portion of our lab, and we also have another side which is called the treatment area, where you would go and have your cleanings and restorations or fillings replaced. So you'll learn both sides of dental assisting.
Yeah.
But over here, they're learning how to mix materials, and right now 2 of our students are doing alginate impressions, and with those impressions, they'll pour them up in a gypsum-like plaster, and when it's all set up, then they will have models, which is of the patient's top and bottom teeth, so that the dentist has something to look at after the patient leaves.
And, we're all familiar with that. I think that's bearing down and feel that kind of
putty, pudding type, yeah.
And so the dentist can do what with this once you make those?
This one is called a study model, so that after the patient leaves, the dentist can look and see, okay, our patient has a problem because when they bite down, their lower jaw is out furthermore, so do we need to do something as far as ortho, or is it something that we can't really adjust without doing removing some teeth and rearranging the sequence of it?
Dental assisting education at MCC. What's the history of the program?
The history is we're the first dental assisting program in the state of Nebraska, and that was back in 1962, and we were established by the dentists in the area, and we still continue to have major support from all the dentists in the area as far as the program is concerned.
So if you're enrolled and you want to be a dental assistant, what's the process, and how long does it take to finish the program?
Okay. We do have a procedure that you have to go through in order to be considered for the program, and there's some testing involved with it, and then as we progress through, you get preliminary approval, and then the final approval is based on background checks and drug testing, which is something that all the allied health programs require. And that's in order to make sure that once you graduate, you're going to be able to get jobs in your field.
But what educational requirements before that?
As far as educational requirements, at least a high school diploma or GED. And if you can get your math and psychology courses done prior to coming in the program, that's a plus. It's not required, but it does help you because we do our selection based on a point system. And you have to have so many points in order to be considered for the program.
Once you're in, how long does it take before you're finished?
The program is 4 quarters in length, and we only accept students once a year, and that's in fall quarter. And then you'll graduate in the middle of August during summer quarter.
Okay, so it's about a year.
It's a year.
Yeah, it's 1 year.
1 year in length. So our quarters are 11 weeks, except for 2 of them now, which are 10 weeks. But you do have a break in between, so it's not like a semester where you're going a longer period of time without a break.
And then I'm a dental assistant.
Then you are a dental assistant.
Certified, or how does that work?
You will be certified in x-rays, taking x-rays, and also in coronal polish. And that's the portion of when you're going to get your teeth cleaned, either the dentist or hygienist will take and scrape the teeth. And then when we go to polish, that's the part that we can legally do once we graduate. And that's where, if you think about it, they'll put a handpiece in or a thing and spins around. You have all this gritty in your mouth. That's coronal polish. So that's what our students can do once they graduate. We also will have more expanded functions later. We just are in the second stage of getting a bill passed that would allow dental assistants to do even more.
Such as cleaning, maybe? Or?
Well, no, not the scaling of the teeth, but the coronal polish, which we can do now. But it would be like doing other expanded functions, such as placing a material around a tooth so that when the dentist takes the impression, it's going to be a good one in order to have a cap or a crown made.
I think we can all relate to that if we've been in any amount of dental work. So what are job opportunities as a dental assistant?
Job opportunities are fantastic. Right now, I've got over 15 offices looking for one of our grads, and we can't help them out at this point in time. And all of our graduates, when they graduate, especially the last 2 years, had at least 2 or 3 different options of employment. So they were able to select the office that they wanted to go to.
That's pretty cool.
Yeah,
so you
it's
know
great.
If you get into this field,
right.
that it's a career.
Right. And also over the next 10 years, it's estimated that there is going to be an even bigger demand for dental assistants. So,
why is that?
Part of it is getting more into the expanded functions area where we can do more that allows the dentist then to do other detailed procedures while we're doing something else.
So, Joan, you mentioned in the lab here they're doing impressions. We've got 2 people working back here. Now we've got another part of the lab, right?
Right. We have another part, and we call it the operatory area, or that's the treatment rooms, and that's where the patients will go, and we do procedures over there. So if you'd like, I'd like to take you over there so you could see that area.
So who do you test on? I mean, how do you work?
Well, I'll
volunteers?
show you. Well, we have volunteers that are just like you see the plastic heads that the students are taking. We start out on fake
Plastic?
patients, plastic and metal. They don't cry, they don't get mad, they don't get sick, and they don't sue. But it allows the students to go ahead and start first on that. And then after that, when they pass those requirements, then they go ahead and do it on each other.
On each other.
And then with x-ray especially, then they bring in outside of patients to go ahead and take x-rays as well.
Let's go take a look. And we are back. We are talking about dental assisting as a career at Metropolitan Community College. As Joan Trimpe joins us again, we've moved from one part of the dental lab to another. The first part we looked at was all about impressions.
Impressions and mixing materials.
Mixing materials. And this is basically about what?
This side is what we call the operatory side, or also the treatment rooms, and that's where we bring patients back for either an exam, cleaning, to have a tooth filled or a tooth removed. So our students get experience with hands-on with the instruments as well as equipment. And in our operatory area, we have all different types of dental units and chairs and stools. So our students have a chance to work with different types of equipment before they go out to do their clinical experience.
How much of the time in the year's study is spent in this side versus the other side?
It's probably about 60% over here and 40% on the other side. But in some ways, they still blend together as they progress through the program. As far as, for example, taking x-rays, they'll take the x-rays here, but then they go to the other side and they learn how to mount them correctly, and also preparing tray setups for that.
So they don't just spend their time there and move here and not go back.
It's kind of a back and forth situation with the students.
What are these ladies doing?
These ladies are placing a rubber dam in a patient's mouth, and rubber dams are something that's a plus for when you're working with a patient. It helps to protect so that things don't go down the patient's throat. It keeps a lot of the liquid and everything else from going down the throat as well.
How difficult is this to master?
A lot of it's going to depend on the patient. If they have teeth that are really close together and really tight, it's going to be a little bit harder to do. Otherwise, it's fairly easy, and the students will be doing this also when they go up to Creighton in spring quarter for their first part of clinical experience. And then in the summer quarter, they will be going out to private offices, and they'll be there 3 days a week, and they'll work with the dentist and the assistant there with patients. So they get a lot of good experience between Creighton and the private offices.
So again, they work on plastic models, they work on each other, eventually they work on what
eventually it's
would be a real
patient. Yeah.
And so is this the dental dam chair? I mean, what else do you do? only that here at this chair?
No,
Okay.
any chair can be used for the dam. Any chair is used for any of the procedures that they're learning, or, for example, tray setups. They learn how to do tray setups for doing an extraction. They learn how to do it for a crown prep, for silver fillings and composites, which is tooth-colored substances.
And we saw a couple of students practicing handing their instruments to the dentist, right?
Right.
And that speeds the process
It
up.
speeds it up. It cuts the time in half because the assistant's able to give them the instruments, mix the materials, and have it there ready for the dentist. So it really does save a lot of time for everybody.
How much of dental assisting education at Metropolitan Community College is spent in the lab versus in the classroom? Or is the lab the classroom?
There's some classes that are just basically theory, like anatomy and that. However, most of the other classes, it's a combination of theory, and then they come over here and they put it to use. So if you're an individual that likes to work with your hands and like to work with people, dental assisting is a good career. But it's not only just for in the dental office and a general dentist, but you could also work when you graduate in an oral surgeon's office, pediatric office, orthodontic office. If you decide, though, that you'd prefer to just work with your hands, you could go work in a commercial dental lab. You could work for an insurance company doing dental claims. When you get your baccalaureate degree, you could also teach, like what I'm doing right now. So you've got a lot of options for just 1 year of education that you've got.
Joan, talk just a little bit about the importance of state-of-the-art equipment, because I imagine it changes dramatically and fast in this field, doesn't it?
It does as well here. We've gone to where seeing maybe a few offices that have computers at the reception area when you come in, to now where each operatory or treatment room has its own computer, and everything is done on the computer as far as the charting and the procedures that were done.
Even scheduling.
Even scheduling. So it's a lot more involved with the computer.
Tell us why you think MCC is the place for dental assisting education.
I think probably the biggest thing is that we have such a major good support from the dentists in the area, and we always have. Also, the facilities that we have here, and
Which gets back to equipment.
Gets back to equipment, and we continue to update as changes take place with the equipment as well. And
so
we're proud
nothing's
of
really
that.
outmoded here.
No.
That's the thing.
No,
Right.
nothing is. There's still some basic things in dentistry that will never change, but equipment, and now with computers, that's the part that's changed the most.
Tell our viewers, who would this be a good career for? What type of person?
Someone who really wants to help people and make them feel better, and it's a great job as far as it's just during the day. You don't work on holidays like some other areas. You don't work at night. The only place you might do that is if you want to move to California. And they have dental offices,
anytime, right?
yes, 24/7
Yeah.
in California. But here it's pretty basic, and most offices now are going to 4-day work weeks as well. No Saturdays. So a lot of opportunities for not only full-time but part-time employment.
And how would a prospective student investigate coming to school here?
The best way would either be contact me, and that's on the website that you can go to. Or even on the website, you have dental assisting, and it gives you the actual information and admission packet that you can pull up, and it explains step by step the process to go through to find out about the program and how you would apply for the program.
Perfect. Joan, thanks much for the tour and all the information.
Thank you.
Appreciate it very much. Thanks to our students. Ladies, you want to say hello and goodbye? Hello. Very well. There you have it, MCC's Dental Assisting Program, preparing today's students for tomorrow's careers. Thanks to Joan Trimpe. I'm Kent Pavelka, and thank you for watching. And be sure to join us again for a future edition of Metro and More. If you have comments or questions about the program, please email us at metrovision@mccneb.edu. Thanks for watching.